Today we'll be talking about glomerulonephritis. We're going to talk about the symptoms, causes, complications, how to prevent this, the diagnosis process, and the treatment plan for this. So first off, what is glomerulonephritis? It is the inflammation of tiny fibers of the kidneys. First off, we're going to start with the symptoms of glomerulonephritis. These symptoms include pink or cola, tea-colored urine from red blood cells being in the urine, foamy or bubbly urine due to excess protein escaping in the urine, high blood pressure, fluid retention with swelling in your face, hands, feet, and abdomen. You typically urinate less frequently. Nausea and vomiting may come along with this, as well as muscle cramps and fatigue. Causes of glomerulonephritis. Starting with infections. Infections can directly or indirectly lead to glomerulonephritis. Starting with post-streptococcus glomerulonephritis. This can develop within a week or two of recovery from strep throat. It's when the inflammation occurs when the antibodies to the bacteria build up in the glomeruli. It's most likely to occur more in children than adults. But on the upside, children do recover quicker. Second is the bacterial endocarditis. It's an infection of the inner lining of the heart chambers and valves. It's not clear whether the inflammation in the kidneys is a result from the immune system activity alone or other factors. Third is kidney infections. Viral kidney infections such as hepatitis B and hepatitis C. They cause inflammation of the glomeruli and other kidney tissues. And last for infections would be HIV. HIV can lead to glomerulonephritis and progressive kidney damage. This is typically before onset of AIDS. Other causes of glomerulonephritis are autoimmune diseases, such as lupus, which is a chronic inflammatory disease, Goodpasture syndrome, which is a rare disorder. It's when the immune system creates antibodies to tissues in the lungs and kidneys, and it can cause progressive and permanent damage to the kidneys. Another autoimmune disease would be IgA nephropathy. This occurs when deposits of antibodies accumulate in the glomeruli. The inflammation and damage may go undetected for a long time, but your most common symptom with this is blood in your urine. Vesiculitis and sclerosic conditions. Polyarthritis. This affects medium to small blood vessels in many parts of the body. Granulomatosis with polyangiitis, affects small and medium blood vessels in the lungs, upper airways, and kidneys. High blood pressure. This is basically when it becomes a long-term thing. It's poorly managed. It can cause scarring and inflammation of the glomeruli, which the glomerulonephritis inhibits the kidney's role in regulating blood pressure. Diabetic neuropathy, which high blood sugar levels contribute to scarring of the glomeruli and increase the rate of blood flowing through the nephrons. Local segmental glomerulus in this condition, scarring is scattered among the glomeruli. This can result from other diseases, or it may have no known reason. Other causes of glomerulonephritis is certain cancers: gastric cancer, lung cancer, chronic lymphatic leukemia. They're all causes that can lead to glomerulonephritis. Complications with glomerulonephritis. Complications with glomerulonephritis affects the ability of nephrons to filter through the bloodstream effectively. The breakdown in the filtering system results in accumulation of waste and toxins in the bloodstream, poor regulations of essential minerals and nutrients, loss of red blood cells, loss of blood proteins, acute kidney failure, chronic kidney disease, high blood pressure, and nephrotic syndrome. Nephrotic syndrome is basically too much blood protein in the urine and there's not enough in the bloodstream. This can lead to high blood pressure, high cholesterol, and swelling of the face, hands, feet, and abdomen. In rare instances, it may cause a blood clot in the kidney vessel.
How is glomerulonephritis diagnosed? Along with completing a medical history and a physical exam with you, your medical provider may also do a urinalysis. This test checks the urine for red and white blood cells, infection, or too much protein. A blood test, a test to measure the levels of waste products to find out how well the kidneys are filtering. An ultrasound of the kidneys. This test uses high-frequency sound waves and a computer to make images of blood vessels, tissues, and organs. It's done whether to see the size or shape of the kidney is abnormal. Ultrasounds are used to view organs as they work and to check blood flow through the blood vessels, as well as a kidney biopsy. In this test, tissue samples are removed from the kidney and checked under a microscope. What is the treatment plan for glomerulonephritis? Treatment plans are based on several things with your healthcare provider. These things are based on how old you are, your overall health and medical history, how sick you are, how well you can handle specific medicines, procedures, or therapies, how long the condition is expected to last, as well as your opinion and preference on the treatment plan. Although glomerulonephritis cannot be cured completely, there are several treatment options that can slow the progression of the disease as well as prevent complications for it. These include blood pressure medicines such as ACE inhibitors that protect blood flow into the kidneys, corticosteroids that may be used to decrease inflammation that leads to scar tissue, diuretics or water pills that may be used to remove excess fluid in the body through more urine production, diet changes including eating less protein, sodium, and potassium, dialysis to remove waste and fluid from the blood after the kidneys have stopped working, or possibly a kidney transplant that replaces your diseased kidney with a healthy kidney from a donor. Although there is no proven way to prevent glomerulonephritis, some practices may help. Eating a diet of healthy unprocessed food, managing high blood pressure with a low-sodium diet, exercise, and medication, preventing infections by practicing good hygiene and safe sex, avoiding using needles for illegal drugs, and seeing a healthcare provider whenever you have an infection such as strep throat.